I'm Alyssa Bochenek with Sovereign Media, and I'm here to walk you through President Trump's resolve to eliminate the Affordable Care Act, also known as Obamacare. In the first month of his administration, guidelines made to help Americans obtain insurance under the Affordable Care Act, or the ACA, were eliminated from the landing page of the official Health and Human Services website. By February, all other pertinent ACA information from the landing page of the website was removed. The removal of the ACA information didn't stop with the landing pages. All positive references to Obamacare were stripped from the Health and Human Services website, which made it more difficult for Americans to obtain relevant information about their rights to affordable health care. Also in February, the Department of Health and Human Services weakened enforcement of the individual mandate to obtain insurance. These policy changes tightened enrollment procedures for new enrollees while also slashing the enrollment period by 6 weeks. That's 50% less time to enroll than in previous years. President Trump and his appointees have seized every opportunity to reinforce the idea that Obamacare is a failure. Even the White House's official Twitter account has made grandiose claims about Obamacare negatively affecting Americans. For example, a recent tweet stated that #Obamacare has led to higher costs and fewer health insurance options for millions of Americans. It has failed the American people. However, the Gallup Healthways Index showed that the rate of uninsured Americans dropped by as much as 7% only 2 years after Obamacare was implemented in 2014. In April, Americans saw a change to tax credits. A new rule set to take effect in 2018 will see a decrease in subsidies meant to offset premium costs. This means that most Americans will be paying for more expensive health coverage through higher deductibles and copays. Rising costs can make or break a patient's ability to afford rehabilitation treatment for addiction and mental health conditions. It can also make it more difficult for patients who need mental health and addiction treatment to obtain the most basic coverage. Patients in treatment for mental illness and substance use disorders are among the most vulnerable to this change, as many cannot afford the higher premiums proposed by the current administration. In June, members of the President's cabinets petitioned Congress to attempt to pass a substantial repeal that would effectively end Obamacare without replacement. In 2017, former Health Secretary Tom Price consistently tweeted infographics from his official government Twitter account that negatively portrayed and targeted the Affordable Care Act. The U.S. Department of Health and Human Services has continued this trend by funding and releasing negative videos about the Affordable Care Act's effectiveness.
Obamacare has been a total failure. It's been predictable. Everybody said at the beginning that small business would not be able to maintain coverage, and they were right.
Every year in January and February, when we have a child get sick, we're now going through and trying to find a new doctor.
Obamacare's only helped 1 out of 6 people.
By focusing on Americans with current insurance who are affected, the viewer doesn't see how effective the ACA can be for Americans struggling financially to afford care. The Department of Health and Human Services produced these videos using the budget set aside to promote Obamacare. The same budget was cut by 90%, or $90 million, 1 month later. This funding is essential to increasing awareness of open enrollment periods and informing the public of what coverage can be provided by the ACA. With this limited funding, many people will not know how to enroll in Obamacare. Nonprofit companies that assist with enrollment, known as navigators, are also facing cuts of over 40% to their budgets. In addition, health department officials will not have the funding to attend forthcoming enrollment events. By decreasing the advertising budget and limiting the number of people that assist in sign-ups, patients will struggle to submit their proper paperwork on time. And as a result, many people will lose the opportunity to obtain coverage. In September, the Trump administration took this one step further by announcing that the Affordable Care Act website would be completely shut down for maintenance for 12 hours every Sunday during the open enrollment period. Typically, Sundays are one of the few days people have available to take care of important matters such as health insurance. On October 12th, President Trump signed an executive order allowing the sale of less expensive, less inclusive plans. President Trump's order ends subsidies that help low-income people pay for coverage out of pocket, leading to potentially higher premiums for health insurance for those who need the most assistance. This leads Americans to scramble for health care coverage as full insurance coverage becomes increasingly unaffordable. These changes to the ACA will have a devastating toll on the most vulnerable of Americans who are searching for mental health and addiction treatment. It is likely that similar changes will continue to occur as open enrollment continues. We'll keep you updated as the story develops. For Sovereign Media, I'm Alyssa Bochenek.